evening. Boys will be boys. This cliche perhaps comes to mind when you see a hyperactive little boy. What do you think of when you see a girl? Girls are usually docile creatures, but have you ever considered the minds of those seemingly calm girls may actually be climbing the walls while their bodies remain quietly seated? I once thought that attention deficit hyperactivity disorder, or ADHD, was only associated with boys until both of my daughters were diagnosed. I know firsthand the difficulties experienced in attempting to arrive at a diagnosis of ADHD for a girl. Today we will explore the different symptoms presented by girls with ADHD, why these symptoms are challenging to diagnose, and recent changes in diagnostic criteria that will hopefully improve diagnosis in girls, so that, as Dr. Stephen Henshaw stated in his interview from Talk of the Nation in November of 2008, girls do not have to, quote, suffer in silence. Most people associate hyperactivity with ADHD. Girls' symptoms present differently than boys. According to Dr. Patricia Quinn, a leading expert in ADHD, in her 2011 book, 100 Questions and Answers about ADHD in Women and Girls, symptoms in girls include excessive talking, hyperreactivity, such as crying a lot or slamming doors, losing things, difficulty sustaining attention, the appearance of not listening. Dr. Henshaw also noted in the previously cited interview that a primary symptom exhibited by girls is disorganization. Females are also apt to internalize their symptoms, as seen by comments such as "I'm stupid" or "I can't do anything right." In the article, Attention Deficit Hyperactivity Disorder in Girls, published in CNS Drugs in 2006, authors Judd Stoller and Stephen Ferrone state that this internalization can lead to other psychiatric conditions such as anxiety and depression. Author Nicole Crawford hypothesized in her web article, ADHD, A Women's Issue, from February 2003, that ADHD may present differently in girls due to hormonal influences present from their very beginning. According to the Stoller and Ferrone article, quote, "For the past 75 years, hyperactivity has been the cornerstone of ADHD, and it is the subtleties of inattentiveness that make diagnosing ADHD in girls more challenging." Dr. Quinn describes in her book that ADHD is a diagnosis based solely on a set of behaviors that impair functioning across the lifespan. Most standardized teacher and parent rating scales emphasize externalized symptoms such as hyperactivity and impulsivity. Many teachers have stated that they have not received adequate training in recognizing ADHD. According to pediatrician Dr. Susan Boutros, in her 2007 book, Attention Deficit Hyperactivity Disorder, quote, "Many teachers learned very little about ADHD during their formal training because many of the symptoms were not well described until the 1990s. Teachers also tend to compare girls to boys with ADHD, consequently, dismissing the less obvious signs. This is called teacher bias, according to the Stoller and Ferrone article. Girls with high IQs or extensive support at home learn coping mechanisms, which further allow them to remain undiagnosed. These girls work harder to compensate or hide their symptoms in order to meet teacher and parent expectations." It was also noted in the previously cited web article, ADHD, A Women's Issue, that girls are raised with different socialization skills than boys. Dr. Quinn states, quote, "Females with ADHD pay the additional price of having gender role expectations placed on them by a society that has no equivalent of boys will be boys for girls with ADHD. Until recently, statistics showed that boys were diagnosed 9 times more often than girls. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, also known as the DSM-5, was published in May 2013. This latest edition broadened the criteria clinicians use in making a diagnosis of ADHD. Previously, to be diagnosed with ADHD, symptoms that caused impairment must have been present before age 7, and the impairment had to have been noted in several areas across the lifespan, such as at school, work, or home. The new criteria state that several inattentive or hyperactive/impulsive symptoms must have been present before age 12. Also, the new manual includes examples to aid the clinician in the application of the disorder across the lifespan. These changes came as a direct result of the recognition that girls were being underdiagnosed. With the aid of the DSM-5 changes, the current ratio of boys to girls with ADHD is 3:1. ADHD was first recognized in the 1960s as minimal brain dysfunction. In the years since, it has become a disorder that most of the public associates with boys. Recently, more parents, clinicians, and teachers are realizing that girls, too, can suffer from attention deficit hyperactivity disorder, though they present a different picture of what it looks like. Awareness of the symptoms, their differences, their subtleties, and broadened diagnostic criteria will hopefully create a new horizon for girls with ADHD. Just because a girl receives good behavior marks from her teacher does not necessarily mean that her mind is focused.